Hello, Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient which you had requested. The area of interest is the upper left and the upper right quadrant for implant placement. This is the panoramic view. You can see that we've got a BTR in the upper left lateral. We've got edentulous areas in the premolars, and we have a broken down root in the upper left molar. We've got an edentulous lower left region, and we've got an edentulous lower right region with a broken down and infected lower right 7. Now we've actually gone ahead and placed implant, but before the implant placement, I'm going to go ahead and measure the ridge for you. This is where the BTR of the lateral is. If an immediate implant placement can be achieved here, so you've got approximately 7 millimeters of width with a good 18 millimeters of height. In the premolar region, we've got the first premolar is slightly thin ridge, but we've got 5.6 mm of ridge width with a good 16 millimeters of height. The second premolar, we've got a good 6 millimeters of width with 10 millimeters of height. And the first molar, if it can be extracted, so we've got a good 10 millimeters of width with 5 millimeters of height. So an additional sinus lift might be needed for the implant placement in the upper left first molar region. Now moving to the lower left first molar region, we've got very good bone. We've got approximately 8 millimeters of width with a good 15 millimeters of height, and then we've got a slightly angled ridge, 8 millimeters of width with 12 millimeters of height to the inferior alveolar nerve. This is the lower right segment. Now the lower right segment, you can see we've got approximately 6 millimeters of width with a good 15 millimeters of height, and in the first molar region we've got 7 millimeters of width with a good 16 millimeters of height, and then moving to just before the lower right 7, we've got a good 8 millimeters of width with 12 millimeters of height. The lower right 7 is infected with bone loss and glossary caries as well. So we would highly encourage our doctor to place a graft here post extraction of the lower right 7. Now we've gone ahead and actually done a lot of implant placement for our doctor, which we will show you in just a second. So there we go. We've placed new biocheck implants. The yellow denotes 3.8, so we've got two 3.8s in the upper left premolar. The orange denotes a 3.2 because it's the lateral, so we can use a thinner implant. The greens are all 4.5 and 4.3 in nature. So this is how the implant placement looks. We'll share an implant placement report with the doctor so they can see how the implant is well supported by bone all around. We've made sure that these are all prosthetically driven implant placements, and we've also made sure these implants are away from all these significant vital structures. So if there are any further questions, please feel free to reach to our team. We would be extremely happy to help. Thank you very much. The bone quality overall in the upper jaw is D3, and the bone quality in the lower jaw is D2.